to my great surprise, I fell into a lot of ophthalmic nursing because the sister in charge seemed to like me, and obviously she put in a word for matron that give me that nurse back again, she's really good. Fine, okay. So what we did in the eye ward, and remember we had mostly veterans and serving members because it was just at the end of the Korean conflict. We did have war widows and of course any serving members, women serving members of the military, but we didn't have any children. So to me, the clearest memory I have is of all these guys with iritis in their dressing gowns coming up to the treatment room 3 or 4 times a day, having their hot spoon baths, and they really liked that because the heat was so soothing. And I believe iritis is so painful. Thank God I haven't had it myself. So that sounds very clearly, because there was a lot of work for nurses. We had all the bandage the wooden spoons and get the hot boiling water ready in their little bowls along benches. But they were all nice guys and they were so grateful for our good care. And I think it's of interest for people to know about vaccinotherapy, which was very big at the time in an attempt to stimulate the immune system. So boiled milk, I think tuberculin toxin too was another thing that they used to inject. I really have no idea of the efficacy of these treatments at all, and I think that disappeared sometime soon, after that. So we had, of course, their various corneal diseases and things, as you can imagine, would have happened to people in World War II and in the Korean conflict. But we had a lot of cataract cases because they were World War I guys turning up for their cataracts, and this was really a major thing. They would be admitted to hospital 2 to 3 days before their surgery and put on a low residue diet, which was very minimal. If you have a look in a dietary book, low residue means white bread, rice, white sauce, chicken, milk, junket, things like that, which are, to a man, it's really going to be horrible food. Anyhow, low residue diet, and off we go to the day prior or the day of surgery, depending on the time. Eyelashes were cut. Well, they're very tricky things to get someone to hold somebody's lid and start trimming their eyelashes. So all the top lashes were cut, and on the bottom lashes, they left a central piece of eyelashes because they were worried that if they all cut lashes, the eye could turn over under the dressing and of course scratch the cornea. So there was this really tricky thing to do. And then of course penicillin pool drops were commenced, and they were every couple of hours, so that the patient went off to theatre having his eyelashes cut, his bowels fairly confined, and off he went down to the theatre. Of course, the surgeons didn't use gloves in those days, and as you know, all the graphene eyes were tested on those little kid drums, and everything was done like that. So he came back from theatre. Hopefully everything had worked out in the theatre, and he found himself lying in bed with a sandbag on either side of his head, and at night time the hands were manacled to bed rails because they couldn't rub their eyes. Okay, all right. So absolutely flat on the back, and bowels are still confined, still having this ghastly food, which is really awful, and then gradually after a few days allowed a little bit of sitting up. It really took about 8 days before people were on their feet and mobile again. And then of course dramas of sutures out, things like that. But if it worked, it worked, and you had those lovely thick glasses prescribed, and people got their sight back. So I guess it was much better than fumbling around in a darkened world. And to me, it's very interesting that nursing staff in the clinic in those days did all the clinical work. We did the fields, we did, under supervision of course, we trained to take pressures using the Schiotz tonometer. And of course, I married a just graduated doctor who, for some reason, to my great surprise, some years later decided, after dallying with obstetrics, thought, no, lousy hours in obstetrics, I'm going to do ophthalmology, it's much more civilised. And so I always worked in our rooms in between children and that sort of thing. So I've grown up with ophthalmology all the way, and our son is a retinal surgeon.